Hello, my name is João Neves, and I am a gastroenterology resident at the Algarve University Hospital Center in Portimão, Portugal, and I'm also a member of the ESGE Green Endoscopy Working Group. I am pleased to present to you today the findings of our recently published article in Endoscopy entitled Perspectives and Awareness of Endoscopy Healthcare Professionals on Sustainable Practices in Gastrointestinal Endoscopy, Results of the LEAFGREEN Survey. The healthcare sector remains one of the main contributors to climate change, and gastrointestinal endoscopy is believed to be among the top 3 clinical waste producers within hospitals. Despite this, even seemingly straightforward measures, such as the proper disposal of endoscopic waste, have revealed themselves a challenge, not only due to a general lack of awareness among endoscopy staff, but also due to the existence of several institutional barriers. Recent assessments of the perspectives held by the leadership of major endoscopic societies indicate that a lack of comprehension of the issue, coupled with its perceived interference with daily work routines, seem to justify the detachment between the priorities of GI societies and the leaders' ranking of the problem. However, these assessments may not accurately reflect the beliefs and behaviors of individual members within these societies. Hence, a more comprehensive understanding of sustainable practices among endoscopy healthcare professionals is urgently needed. In order to assess the opinions and depth of knowledge among ESGE and ESGENA members on sustainable GI endoscopy, the ESGE Green Endoscopy Working Group developed the LEAFGREEN survey. This web-based survey aimed not only to understand the perspectives of ESGE and ESGENA members, but also to assess their attitudes and identify barriers hindering the adoption of sustainable practices in GI endoscopy. Additionally, this survey also sought to pinpoint research and training priorities within this context. In total, we obtained 407 responses, corresponding to a response rate of 11%, with most participants being ESGE members and endoscopists. When discussing the carbon footprint of GI endoscopy, it is crucial to recognize that it starts well before reaching the working place. Surprisingly, over 50% of our respondents still prefer to use their fossil fuel private vehicles to commute. In terms of climate change and sustainability beliefs, 86% of ESGE and ESGENA members acknowledge the reality of climate change, attributing it primarily to human-related emissions. However, when asked specifically about GI endoscopy's contribution to climate change, 1/3 still perceives it as a non-contributor. Appropriateness improvement of endoscopic procedures was considered as the most important measure to reduce the carbon footprint of GI endoscopy, followed by the need to reduce the use of single-use accessories. Interestingly, when participants were questioned about who should bear the most responsibility for minimizing the environmental impact of GI endoscopy, the majority ranked GI endoscopists and auxiliary staff along with the industry at the forefront. An alarming finding of our survey was the high rates of endoscopy units lacking recycling facilities. Almost half of the respondents either don't have or are unaware of the existence of recycling facilities at their workplace. And although participants considered waste segregation to be important, almost half are unaware of how to perform this undertaking. This lack of awareness can be attributed in part to the fact that 80% of participants neither receive regular training sessions nor undergo audits on waste management in their endoscopy units. This underscores the notion that achieving a sustainable GI endoscopy unit extends way beyond individual clinical decisions and requires changes at an institutional level. In terms of future research, our members believe further evidence on how to minimize unnecessary endoscopic procedures, along with comparative studies between single-use and reusable accessories, is urgently required. Lastly, recognizing that institutional barriers consistently hinder the adoption of sustainable practices, we inquired about the challenges our members face in implementing sustainable endoscopy in their units. The feedback indicates that a lack of policy support and insufficient knowledge among endoscopy staff members are common impediments across various units. To conclude, the LEAFGREEN survey was the first international survey that assessed the personal attitudes and level of knowledge on sustainable practices among members of 2 endoscopy scientific societies. ESGE and ESGENA members are aware of the current climate crisis as a major threat. Inappropriateness of GI endoscopy and single-use accessories and endoscopes were recognized as the major environmental challenges for the upcoming years. And lastly, this survey highlights that sustainable endoscopy goes beyond clinical decisions, requiring changes at an institutional level. And despite prevailing skepticism among the majority, endoscopy societies should strive to adopt the 2050 net zero goal, thereby accelerating the transition towards a greener future for endoscopy. If you're interested, you can read the full publication of our article in Endoscopy. Thank you very much for your attention.